Good morning, ladies and gentlemen. On behalf of my colleagues, it is my great pleasure to present the primary results of the double-blind, placebo-controlled phase 3 SHINE clinical trial in mantle cell lymphoma. I'm Michael Wang from the University of MD Anderson Cancer Center. Here are my disclosures. Mantle cell lymphoma, as we know, is a rare but distinct subtype of B-cell malignancy. And the older patients with a newly diagnosed mantle cell lymphoma are usually treated by chemoimmunotherapies, the most common one being bendamustine-rituximab. Everybody knows that bendamustine originated from Europe. The rituximab maintenance after BR was also proved to be effective to prolong failure-free survival or progression-free survival in 2 independent studies. Ibrutinib is the oral first-in-class BTK inhibitor that has transformed the care of relapsed mantle cell lymphoma. And the Ibrutinib is especially effective when we use it at the first relapse. The Ibrutinib plus bendamustine-rituximab was proved to be effective and safe in a phase 1b clinical trial. With all those rationale and background, we designed the SHINE clinical trial. In this trial, we enrolled previously untreated patients at the age of 65 or older. As you can see in the experimental arm in blue, we included the BR for 6 cycles with R maintenance, plus Ibrutinib until progression or tolerance. As shown in green, the placebo arm, we included BR for 6 cycles with R maintenance plus placebo until progressive disease or intolerance. The primary endpoint of this phase 3 clinical trial was progression-free survival in the ITT population. The primary endpoint of this study, PFS, was met. In other words, our SHINE clinical trial is a positive study because it successfully met its primary endpoint. Our trial showed that the Ibrutinib with the BR plus R maintenance showed a significant progression-free survival improvement. As you can see, the median PFS was 80.6 months in the experimental arm versus 52.9 months in the placebo arm. The hazard ratio was 0.75, and those are statistically significant. The 2 curves separated early because the benefit was separated early, clearly, and the benefit remained durable throughout the 7-year follow-up period of time. If we express all those times PFS instead of months into years, with a median follow-up of 7 years, the median PFS was prolonged by a net of 2.3 years because it was 6.7 versus 4.4 years. This is a very significant 50% improvement compared with the placebo arm. The safety profile was consistent with the new profiles of Ibrutinib and bendamustine-rituximab. And here we show the common treatment adverse AEs, or TAEs, at 20% or higher. As you can see, the first-line neutropenia was the most common TAEs in either arms and accounted for around 50% in each arm. Rash and pneumonia was 10% higher in the Ibrutinib arm. Diarrhea and anemia was higher in the Ibrutinib arm. In conclusion, SHINE is the first phase 3 trial showing that Ibrutinib in combination with chemoimmunotherapy is a highly effective first-line therapy for older patients with mantle cell lymphoma. The median PFS with the Ibrutinib arm was 6.7 years. This is the longest PFS arm ever published in this population. There is a statistically significant and clinically meaningful net 2.3-year advantage in terms of PFS, favoring the Ibrutinib arm. This is substantially longer than the currently used chemoimmunotherapies, which is usually about 1.5 to 3.5 years. The safety profile was within expectation and was consistent with the new profiles of Ibrutinib and bendamustine-rituximab. In conclusion, the first-line therapy with Ibrutinib in combination with bendamustine-rituximab and our maintenance sets a new benchmark for patients with mantle cell lymphoma who are at age of 65 or older. We thank all the patient families, and we thank all the study teams in 183 sites around in 28 countries. And we thank you for coming to join us.